Welcome everyone, and thank you for joining today's webinar on doing and adapting longitudinal research, what have we learned? In which our speakers will be highlighting some of the methodological and ethical challenges they've encountered when conducting longitudinal research in low and middle income countries. I'm Gina Crivello, a researcher with Young Lives in Oxford, and I'll be chairing today's panel. I was thinking back to when I first joined Young Lives as a researcher in 2006. A few years before that, I had spent over 2 years doing ethnographic fieldwork for my PhD. And at the time, I felt like that was really, really longitudinal. But working in a project like Young Lives gave me a very different perspective, not least because it's team-based across multiple countries using different methods. And the study has now been running for 20 years. So one of the reasons Young Lives was particularly interested in organizing today's panel is because we're now in the final phase of a 2-year project on methodological learning and lessons from Young Lives, funded by the ESRC, where we've been trying to document with the international team key challenges and learning and the conduct of longitudinal research in the various countries where we work. So we wanted to use this event to publicize some of that work. And there's a place on the Young Lives website where you can find all of our materials. And in fact, hot off the press, just as of a few hours ago, we have this synthesis report on the different methodological features in Young Lives, very accessible. I encourage you to take a look. And we'll be uploading the rest of our reports over the next few months. So we've organized today's panel to reflect some of the key themes addressed by that work. That is sustaining large cohorts over long periods of time, ethical questions, adapting research in the context of the pandemic, and opportunities for longitudinal research going forward. We wanted to engage with a wider community of practice, including all of you, and that's why we brought together a mix of longitudinal projects and perspectives for this panel. We've opted for shorter presentations and a greater number of speakers, but we're also relying on all of you, the attendees, to engage in the conversation too, which you can do in a few ways. So first, use the chat box. You're probably all familiar with that, but that's at the bottom of your screen. And introduce yourself, where you're from, your role, and post any comments. We have Deborah in the chat room who will be monitoring it, and if you can ask her any general questions as well. Second, you can use the Q&A box also at the bottom of your screen to post your questions to the panelists. And if you'd like to get political, there's a way you can upvote questions by liking them. Also, Sabina will need to leave at the end of the first Q&A, so make sure any questions you have for her, you put early on. Put your questions as soon as you think about them. So we have a really fantastic lineup of 6 speakers, and I'll be introducing them in turn before each of their presentations. We'll have a short Q&A after the first 3 presentations, and then we'll do the remaining 3 and open it up again for Q&A. And we'll aim to end in about 90 minutes. So without further delay, it's my great pleasure to introduce our first speaker, Professor Jo Boyden. Jo is an anthropologist, emeritus professor of international development at Oxford, and former director of Young Lives. Her research has focused mainly on children's experiences of and responses to adversity, particularly poverty, armed conflict, forced migration, and hazardous work, with an emphasis on informing the development of appropriate policies and programs. And I've had the pleasure of working with Jo for several years now. Today, Jo will be talking to us about opportunities and challenges in sustaining cohorts over 2 decades. Over to you, Jo.
Hello, everybody. It's a great pleasure to be joining you. Quite a challenge to put 2 decades into 7 minutes, but I'll have a go. I'm going to start by talking about 4 of the sort of key design features of Young Lives and what their implications are for the study in terms of methodological design aspects of it. First of all, Young Lives was set up at the beginning of the millennium, and it was designed to align with the MDGs, and the idea was to be monitoring the effectiveness of various strategies of in the various study countries to reduce child poverty. The research was to focus on the determinants and outcomes of poverty. So from the very beginning, it was meant to be a policy relevant study. So that's one of the key design features. Secondly, the second feature. It was the first ever comparative mixed method cohort study in low and middle income countries. And it covers 4 very diverse countries, one from each of the major developing regions of the world, as it was at that time, Ethiopia, India, Peru and Vietnam. And the idea behind the comparative aspect of it was to conduct data rounds in each of the 4 countries in the same year, using the same instruments as far as was possible. The third key feature of Young Lives is the large sample, 12,000 boys and girls in total, and their caregivers and households. And the sample is divided into 2 age cohorts born 7 years apart. The sample is spread across 80, initially 80 sites, both rural and urban sites in the 4 countries. It's not nationally representative in any of the countries, but it's very heterogeneous. And the idea was to try and capture the diversity of children's experiences of poverty in terms of ethnicity, language, religion, and caste in India. So it gives the opportunity to be studying group-based differences in children's outcomes. It's a pro-poor sample, so the regions were sampled specifically for being amongst the poorest regions in each of the countries, and the children were selected randomly in the right age groups. The fourth really important feature of the study is it's a multi-purpose study. It's unusual in that respect, at least at the time when Young Lives started, because most of the longitudinal studies in low and middle income countries at that point were really focused on health. It covers a whole range of different ecological niches in children's lives, their communities, their households, their schools. There's also caregiver and individual child factors that are being picked up. And also it's very broad and holistic in terms of the outcomes that the study is looking at, both developmental outcomes, nutrition, health, learning, and cognition and psychosocial attributes on the one hand, but also the social and economic outcomes, such as, for example, family formation, entry into work, entrepreneurship, tertiary education, and so on, now that the young people have reached that age group. So it's quite a complex study, it's quite a large study, and it's multiple countries. So obviously that involves quite a lot of methodological challenges. And I'm just going to pick on the 4 challenges that I think are really key to the study. The first one is that although it was set up as a policy relevant project, in actual fact, it is an observational study. And so the struggle has always been to ensure the relevance to policy of the findings. I think the second major challenge is the complexity of designing multi-purpose instruments that are valid not only across ages, and there have been 5 in-person data rounds, and then the telephone surveys that have been, you'll learn more about, that have been conducted during the COVID pandemic, but also instruments that be valid across different social and cultural contexts, different languages. There are at least 11 languages in the study, and education levels. So it's very easy to end up with either ceiling or floor effects when you've got such diversity, even in terms of children's exposure to education and their progression through school systems. So that's the second major challenge, I think. The third major challenge has to do with cohort maintenance. This clearly is a challenge for all longitudinal studies, perhaps particularly for a study that is now 2 decades old. And bearing in mind that actually originally it was intended to be a 15-year study, so it's been extended and will continue for several years yet. So that makes it quite a complex challenge. It's also particularly challenging because it's a large sample that's highly dispersed, and increasingly dispersed, of course, as the children have grown up, they've married, they've migrated for work, they've moved away from their original locations. And I think it's also important to highlight that the COVID pandemic has obviously been hugely disruptive, both in terms of the ability to interview these young people, which has meant gravitating towards phone surveys, but also because that's increased their mobility in many cases away from their sites. And of course, as they've got older, they're now in their late teens in the case of the younger ones, and early 20s in the case of the older ones, they're very busy. They're busy with raising their families and with working. I think that's the other major challenge. Finally, cost. Cost is a huge pressure on the team. The cost of a longitudinal study that's carrying over 2 decades is enormous. So what have been our strategies for addressing these different challenges? And I'm just going to highlight 3 in particular. One is the partnership structure, which has been absolutely fundamental to the success of Young Lives. Actually, when I was director, I was under a lot of pressure from various donors to abandon the partnership structure and to go for survey companies to do the data gathering by survey companies. And I resisted that pressure throughout. And I'm very pleased that I did, because I don't think Young Lives would be in existence today, actually, if we had fallen for that design. It's what's enabled us to be policy relevant in each of the countries. It's what ensures that the study has an extraordinarily low attrition rate. That means very strong relationships with study participants and with local authorities and other bodies. And it's also vital for the quality of the findings in terms of interpreting the evidence and providing contextually relevant data. The second major strategy has been to work with multiple data types. This enhanced the impact of the longitudinal evidence and at limited or no additional cost. So here, just very quickly to say, a blending of qualitative and quantitative data is incredibly important to capture both the depth and the breadth of the evidence. You can't really do it without that mixed methods approach. Linking data to other data sets, administrative data sets, to assess program impacts, that definitely increases policy relevance. And there were some examples given earlier in the week on how this was done. And also, it's important to note that the policy relevance has grown with time. The power of the evidence grows with every single round. It was hard to get this point across in the early stages when we didn't have this longitudinal element of the study. And then finally, and I'm not going to speak to this because this is an issue that Gina Morrow will pick up in a minute, it's incredibly important to invest a lot of energy and effort in building good relationships with study participants. And this is very much about research reciprocity and ethics. And I will end there and hand over to Ginny.
Great, thank you, Jo, so much. I think you've highlighted all of the sort of key issues that we want to touch on today. But I would like to swiftly move on to Ginny. But let me introduce Professor Ginny Morrow. Ginny is visiting professor at the Social Research Institute at UCL in London and research associate with Young Lives at the University of Oxford. Her research has explored children's work, sociological approaches to the study of childhood and children's rights, the ethics of social research with children, violence affecting children, children's understandings of family, and children's social capital. So an expert on children and childhood. Ginny's talk today is Ethics Lessons from Young Lives 20 Years On.
Thank you very much indeed to Gina for the introduction. And it's a real pleasure to be here. I worked with Young Lives as Deputy Director and with Jo, not least to think about the ethics of Young Lives. So I'm just very briefly going to whiz you through a presentation about some ongoing work that Gina and I are doing. So just to give you a quick diagram of what Jo has just told you about the study, and to get straight away into research ethics, to talk about what we've been up to. So Young Lives from the outset has had a pretty robust and ongoing practical approach to research ethics, maintaining basic principles of trust, respect, and reciprocity, and very much Young Lives saw ethics as covering all aspects of the research, the design, the data gathering, obviously, the survey and the qualitative research, but also dissemination, communications and policy implications, or, you know, even informing the analysis of our data. We need to think about the ethics of what we were doing. So together with Gina, as part of this ESRC funded stream on methodological learning, we've been revisiting with our research teams their experiences by interviewing them about their specific experiences of informed consent over time, relationships and reciprocity, child protection and safeguarding, maintaining anonymity, using photos and visuals, and finally looking at experiences of research ethics committees and institutional research boards, because many of these things have changed slightly over time while the principles remain the same. So as Joe mentioned, and for this purposes of this presentation, I'm just going to touch on two of the key aspects of the report that we're going to be writing. One is research relationships and reciprocity, and I'll just touch briefly as well on informed consent. So as Joe mentioned, the success of Young Lives really depends on sustaining research relationships over very long periods of time. And this has involved managing expectations of participants, trying to avoid the NGO label. We developed scripts really carefully with researchers and in training to explain the nature of the research when gathering informed consent. But researchers, our research teams have talked to us about some of the challenges they've faced in relation to negotiating professional boundaries. Increasingly they're asked for their advice about school or work, and they've felt that they've been drawn closer into families, for example, being asked to be godparents. So here's an example from one of our researchers. At a personal level, I feel a lot of pity. They've been involved in the research for so long, you want to give the respondents something, but you may not be allowed. So you're in between ethics and humanity. Teams have sometimes had to intervene in emergency situations, such as in a family health crisis, or where there have been child protection concerns. And these have been dealt with carefully by the team on a case-by-case basis, with discussion and team working and cascading up to Oxford as necessary. And as one of our Peru researchers explained, we're an observational study, but we are also humans. So basically, when you see someone in need, you need to find some way to help. On the other hand, Young Lives is not an intervention study. We don't have the resources to help families. So the difficult thing is to say when we should help and when we shouldn't. And I think this has really been heightened in the COVID-19 pandemic, but of course it's been a systematic issue all the way through the research. Now, just to touch on informed consent with some main key questions that arose that we felt we needed to address. Of course, there's always a sense of how informed is the consent and what people understand by what you're trying to do. And this had to be set against very fundamental power relationships and hierarchies, especially in cultures where children are generally taught from an early age that they must obey adults, which may make it very difficult for them to refuse to participate. But this has changed over time. And we've also had to adapt informed consent processes because while informed consent is, of course, sought at each round, occasionally new participants, so new spouses, parents-in-law, mothers-in-law, babies have been recruited into the sample. But over time, it's been really interesting how young people have asked questions about the study and their participation in it. And this can be challenging for the researchers too. So there have been heightened expectations from participants, which need to be addressed by the teams. So that participants say things like, after all these years, why hasn't there been any change in my household, in the community? As I mentioned, what advice do you have for my child and my family? You studied a lot about the children. You're like their family. I'd be happy if you gave us guidance on how they can grow and improve their lives. And then questions about when the study ends, will you help my son or daughter do various things, find a job, study, migrate, help me with the dowry, purchase land or housing, and so on. So just to wrap up, because time has been flown by, we have found, and we'll elaborate this greatly in the report, that a collaborative approach has been really important in not only co-producing ethics guidance, but undertaking training, developing strategies, creating spaces and time for shared problem solving and learning about ethics questions. Some of the challenges that Young Lives has faced reflect the long-term nature of the study, but we feel that actually quite a lot of the learning may also be shared by shorter term studies working in similar contexts with similarly vulnerable populations. And of course, this is a given. It's impossible to predict all ethics questions that will arise, and it's vital to treat research ethics as an ongoing process, not a one-off tick box exercise. So we need to simultaneously maintain basic ethics principles of trust, respect, and reciprocity that underpin research relationships. We'll address lots of this. We could write a whole book about it in the report that will be published in the early summer. So please ask us about that and follow that. And that there's a few references and some thanks. Thank you very much. Hope the time was okay.
That was perfect. Thank you, Jenny. I'm interested to see what kind of connections we can draw with Sabina's work. So let me go ahead and introduce our next speaker, Professor Sabina Rashid. Sabina is Dean and Professor at the Brac School of Public Health, Brac University. She's a medical anthropologist by training, and she has over 25 years of work experience in Bangladesh. Her areas of expertise are ethnographic and qualitative research with a focus on urban populations, adolescents, and marginalized groups. She's particularly interested in examining the impact of structural and social factors on the ability of these populations to realize their health and rights. And I know that Sabina will be referring to various projects that she's been involved in, looking at longitudinal aspects. Over to you, Sabina.
Shut up. So I'm going to go into 4 main points. This is going to focus on our learning of the challenges and opportunities and some of the ethical issues that came up while COVID goes on. We at the School of Public Health at Brac University, not just me, my colleagues, we've got about 300 staff, have conducted about 33 rapid research assessments. There's a few that are longitudinal, a couple of them that I'm actually either leading or working with colleagues. So I'm going to give some sort of examples and experiences from 4 main points. One is we need to ensure, particularly this was a completely different switch from us, as we all do a lot of primary fieldwork, particularly for qualitative ethnographies. We are going to the field, interacting with individuals and households. And that brings about certain kinds of questions on power, positionality, dynamics, and how to negotiate informed consent. When we shifted to phone interviews, which we started last March 2020, particularly for the ARISE project, there's another GAGE project, and there's another project on adolescence that we're still following up, and even with ARISE, we started last March, April 2020. So we were interviewing young people, adult residents in slum settlements, and there was also surveys being done in rural areas through phone interviews. And the first thing I want to talk about is researchers, because I think they are they're the bridge in terms of data collection, unless you're doing a PhD or you're it's a much smaller team. So particularly for training of researchers, some of the important points are when you're on the phone, before you even get on the phone, it's a completely different dynamic because it talks about trust, which other researchers brought up, rapport building. There is no eye contact. There is no human interaction. You're on the phone. So I think one of the things that's much more challenging, luckily for the longitudinal research, you get to do follow-up repeated in-depth interviews. And one of the opportunities we have is that we work on the ground with many partners. I think Joe referred to that. Partnerships are very, very important. And ground partners and many of these research respondents, some of these projects, we had started working with them pre-COVID. So we'd already met them. And one group or cohort, as we would say, we had never met. But because we had ground support from Brac, the NGO, or other organizations, legal aid support, they gave us numbers after checking with those respondents. So trust, credibility is very important. And we also had national databases at our school from previous surveillance data. So that's helpful. The other point is that we need to really realize, and we did some training with our researchers, who you're talking to and who's in that room when you're talking to those to the respondents. And we have to be very sensitive to nonverbal cues that you would pick up if you were doing observations face to face. So on phone interviews, and it's not easy and it can be challenging, but we did discuss issues around, is there hesitation in answering questions? Do they go quiet all of a sudden? Do they want to end the interview? Not to push it, not to insist. The important point is, no, we're not going to get data at any cost for data collection, but to be sensitive during COVID. But in general, for IRB processes, you have to have informed consent. It's harder to read these nonverbal cues. So the training around that. The other issue around researchers was trauma counseling. So we had to get counseling for some of our researchers in two large projects, because they were very affected by the narratives they were hearing by these residents living in slum settlements. COVID brought about huge economic, job losses, food consumption had gone down. People were worried. They were talking about emotional anxiety. We also had to have a referral linkage with numbers. And in one case, even though we didn't do any interviews around gender-based violence, we did get a case where someone approached us because her daughter had been sexually assaulted, and we linked them up through phone interviews and online with a legal aid organization that we're working with. I think one of the major challenges is actually being sensitive to communities, their timings. One thing we taught researchers, particularly for repeat interviews, but any interviews, that you have to be very, very sensitive to context. During the complete shutdown last year, we had to ensure that people were willing to talk. They were stuck at home, and we found surprisingly many were eager to keep talking. And phone incentives, which is paying cash for their time, was part of our IRB process. We have an independent ethical review board, which was set up in 2006 at the school. But this was very, very important. You're imposing your time. Two, I think it's very important that people drop out. Turnover, they've changed numbers, they don't want to talk anymore. And particularly post-lockdown, we lost respondents. And that's the reality, and being adaptable and flexible in longitudinal research, and the ethics of respecting the rights of participants not to be able to speak. Finally, the two main points is validation of shorter term research. I mean, there was a lot of criticism about rapid assessments and how valid is it? Is the data meaningful? For some of us who work in Bangladesh and live in Bangladesh, a lot of our work is also geared towards informing policy. And Joe had referred to this, and so did Virginia. We did a lot of media, we published a lot of our write-ups, which is the shorter research, in the media. There's a lot of active research that was taken up by Bangladesh Health Watch, which is a citizens' watch group. There was a lot of policy dialogues that informed even short-term research, talking about people worrying about starvation, the stigma around COVID, low uptake of services. The longitudinal research, what's helpful is not only do you build trust over time, the emerging issues that come up, which means you have to prioritize and change your questions based on the needs on the ground. So the grounded realities of what COVID means, socially, economically, politically, can be captured well. And I think that's very important from a policy programmatic level, living and working in Bangladesh. I think the most important point is that we have to remember that we are in this role to do research, not for the sake of research, but to try and at least create dialogue, create a space for writing and publishing and putting it in newspapers, making sure that we reached out to across communities in a multi-sectoral approach. And I think that's also very important, not just health, but other actors, because when we saw with the COVID pandemic research, being sensitive to communities, ensuring training of researchers and refreshers around the trainers. And finally, my main point is that ethics is something that Virginia captured very, very well. We are learning as we go along. But the main point is to be sensitive. And if we want to engage communities and make a difference in their lives, then the starting point is recognizing those ethical challenges and not hiding it, dealing with it, and trying to figure out some kind of a solution that is fair to them. Thank you very much.
Thank you so much, Sabina. Does anybody have any questions for Sabina in particular? She started to touch on some themes that we'll be returning to in the second part of this panel. That is how studies have adapted in the face of COVID. But she's also linked to Joe and Ginny's presentation. We have a more, we have a question in the question box. I think it was based on Joe's presentation. In the meantime, please send us your questions. So I'll go ahead and read Valentina's question. She says, I have questions regarding partnership with country-based organizations and training for local researchers. And again, that links with what both Ginny and Sabina have also said in their presentations. She asked, how do you nurture the relationship with country-based organizations? And she's assuming that we recruit locals for our longitudinal studies. I did want to ask the question to Sabina about, were there different approaches depending on whether the studies that you did in the context of COVID were engaging longitudinal samples, or were sort of samples that you had to create and were more of the rapid approach? It just brings sort of these different also temporal approaches together, because also in the Young Lives, we've done sort of a rapid approach, but within the longitudinal study. But perhaps we could start with the question around the partnership with country-based organizations.
Should I go first?
Sure.
So with partnerships, I mean, we have a lot of multi-consortium partnerships because we are basically a research-based academic institute. So ARISE is with 8 countries, you know, accountability for communities. One thing about ethics that I forgot to add is that with the budget cuts, there's also ethical implications for the communities that you build trust over, because there's expectations, and that has impacted on partnerships. And I think that's something that I forgot to raise. I had it as a point, but I was so worried, Gina, when I saw your face. I thought, oh God, you know, I've gone over time. But I think these are some things that we need to think about, because many of the things that Joe and Virginia shared, because I've been living and working in Bangladesh since 1993, I've seen it. In terms of our COVID-related research, it was 2 levels. There was some rapid assessments because we wanted to feed in the research to the Citizens Watch Group and to Brac for immediate program responses in particular areas. The ARISE and some of the Gauge is longitudinal, and the Adolescent is longitudinal. We're still continuing it. And that evolved slightly organically, I'll be honest. COVID kept going on. The lockdown happened. Then there was post-lockdown. Then it was like, oh my God, we need to find out how they're doing, because many of them lost their jobs. We owe it to kind of continue the questions and the research. And some of that just evolved because I'm an anthropologist. And secondly, because some of our researchers were like, you know, they're asking us, will you call back? You know, this has happened or that has happened. So some of that has evolved. And I think it's very important to have longitudinal data, just because it shows that complexity of people's lives, and health gets unpacked, even development gets unpacked, and programs and partners are actually appreciative of the information. So partnerships are built over time. We are very open to partnerships, but I think it's very important, back to Joe's point, is to nurture those relationships. And I think even me being in public health, we work across other research institutes that work on maybe other areas, because I think it's very important to get that sort of, I don't know, this multi-pronged approach, even in terms of evidence and research. We also work with a lot of journalists. We work with activists, because I think it's very important on the ground to build those relationships. And yes, all our researchers are Bangladeshi, but we also have a lot of as I would say, foreign researchers, online researchers, but in COVID, it's been local researchers. We had 2 Berkeley master's students who worked with us on sexual trafficking, but they have to be committed. They want to work. They have some experience in that area. And for previous research, we've had people come in and work at the school and come and go. But the main point is partnerships are important. And researchers cannot work on their own, particularly if we're going to work in policy and we want to work with development partners and we want to work with government. I mean, I don't have an option, and I think it's extremely critical. It is critically required. I hope that answered your.
Can I pick up a little bit of
Thank you.
On that, Gina, as well, on the partnership issue? So Alan, sitting in the group, is one of the Young Lives partners, and I think it's really important to emphasize that Young Lives was not ever imagined to be a sort of research centre based in the UK, recruiting local partners as almost sort of secondary. That the local partnerships with national institutes in the 4 study countries are absolutely fundamental to the study, and I see capacity building, for example, as a sort of multi-directional process whereby we learn from our partners and our partners learn from the study team that's based in Oxford. So I think it's multi-directional. Often assumptions are made that all the capacity is in the institution in the north in a study that's involving multiple countries and multiple partner institutions. But that's not the way I ever saw it, at least when I was involved with Young Lives. It's important to say that the skill sets that the local principal investigators and lead qualitative researchers bring to the study are absolutely fundamental, as are the skill sets of the fieldwork coordinators, and they engage in a lot of training of the enumerators and researchers in the study countries. And that training occurs at every single round. It's refreshed, as Sabina is saying, I think refreshing the follow-up, and actually also taking on board the sort of innovations and the new developments that take place over time. You have to be responsive to changing environments. I think the pandemic has brought about a whole new ethos of research. And I don't think any of us ever imagined that we would be doing online interviews rather than in-person interviews. And I think that's brought up a whole new set of issues that you have to be trained for. So partnership is essential, I think, for good longitudinal research.
We have brought in all of the panelists, even though we haven't introduced them yet. But if others would like to input, by all means, just raise your hand so I can see it, or unmute yourself. But there's no pressure to do so. We do have a few more questions. One probably for Sabina, which is from Kath Porter. She was asking, because she's been involved in the Young Lives recent phone surveys during COVID. And she was just asking a practical question about how long you could spend on the phone for qualitative interviews without fatigue of respondents. And were you able to record the interviews? And then I'll go ahead and introduce this. Oh, go ahead, Gina.
Yeah, so the longitudinal is very small. We're following 12 adolescent young adults. I've actually known them since 2006 because they used to be in a drop-in center. So the relationship was built over time. When COVID hit, I've been in touch with them. They got in touch. We give, of course, phone incentives. In reality, practically during lockdown, they were more willing to talk, particularly young women. We have 6 young women and 6 young men. So some are adolescents and some are young adults with children. And with post-lockdown, it might be 30 minutes. It might be even 20 minutes. And we have to call back. They'll say, call back tomorrow at 7. And they may not pick up. So the idea is to persist and be sensitive to that. I've had, phone calls where I've talked for maybe 25 minutes and you're just, they're just opening up. They're like, sorry, I've got to go. Can't speak. The idea is, I think the practical suggestion is, if from an ethical perspective, we have to accept that and respect that. We have all these informed consent procedures. At the end of the day, during COVID, these people are struggling to survive. They don't have the luxury of all of us being on Zoom, having our lives and food and housing guaranteed. So I have to kind of constantly remind a few of my researchers and myself, yes, you get impatient. Yes, you get frustrated. It's tough. You have to try again and keep trying. And that's also the advantage of longitudinal, because you can go back and they'll come back and they'll keep talking. But the reality is it can be 15, 20 minutes, it can be a good 1 hour, because they just settle down, the baby's asleep, or the husband's helping with the household chores. So I think it's important. And I think it's really about recognizing the human dimension of the respondents. That's what it is, rather than we're researchers doing research. And I think Joe and Virginia have talked about that. And it's really looking at them not as objects of study, but we're working with them, doing research with them and learning from them. And I think if that paradigm shift occurs, whether you do in-person or phone interviews, that thinking changes. And I think automatically you have empathy and there's a respect. And they know that from your tone and the way you behave and the way you ask questions. And I think that's hard, but it's important. And I think it's the ethos of doing research in the fields that we work in. Thank you.
Great. Thank you, Sabina. We are going to return to these questions in the second half of the panel. Let me pose one more question, which is quite challenging, and I'm probably going to take notes on the answer. But Kath Ford says, Joe mentioned that high quality longitudinal mixed methods research is very expensive. Given current budget cuts across the board, what would be the panel's key elevator pitch to convince wider donors of the unique importance of this research? Would anyone like to take a stab?
I'm going to take a stab, and then it's Eid tomorrow. So Eid Mubarak, because I'm going to have to leave. And it's the last day of Ramadan. So I wish you all the best. But I wanted to say that the work I do in Bangladesh at Brac University, the work that Joe is doing, Virginia, Rebecca, Caroline, Alan, the work you've done, what is it? The point is to try, we're not saviors, we're enablers. We want to provide evidence in partnership through the work we do to inform policies and programs and ultimately donors and development partners. And if we want to actually create and change lives, I think the pandemic is a critical time to take stock about doing budget cuts is short term and really quite a difficult precedent. I know that no one has the choice, and I'm not blaming anyone, but I do think that longer term approaches need to really take this into consideration, because it undoes partnerships, it can undo community trust, it can also end really good quality work with a commitment to create change. My final point is, if we're in public health and development, and evidence is the heart of what we want to do longer term, and these pandemics are not the first or the last. So we need to come up in conversations with development partners and other actors, solutions on the best way forward. But sudden decisions are not helpful and does a longer term damage to the work that evidence provides in a very meaningful way to create change and improve lives of the most vulnerable and disadvantaged. That's my, it's not even an elevator pitch. I speak from the heart. I live and work in Bangladesh, and the people around this table are also very committed. So I hope it's taken in that spirit. Thank you very much.
Thank you, Sabina. Would anyone like to add, particularly Ginny or Joe, before we turn to the next set of speakers?
Just to totally agree, but the elevator pitch would also be, you've invested all this money in these long-term studies, and now you want to pull it because of a crisis, yet you have such a body of knowledge about those people that why throw it away when you could keep building on it, would be if I was in the elevator with whoever it is, unspeakable. Anyway, yes, to politicians. So, it's an investment, and why bin it? So I think that's an ethics question too, not as Sabina has so eloquently put it.
Just to very quickly add, I think that all the sort of anecdotal evidence that's been coming out in the last few weeks that keeps getting mentioned in the media and elsewhere talks about a whole generation being lost, lifelong impacts of the COVID pandemic. And from my perspective, I think the pitch now has to be, we really need to know what's going to happen. We knew what happened to these young people in their past. They've gone through this horrendous crisis, and what's going to happen to them in the future is absolutely fundamental. And we already have enough indicators to be very concerned globally, but in particular in really poor communities. And the issue of inequality is now far, far more striking than it was even before the pandemic. So there's never been a need greater than there is right now for longitudinal evidence.
Can I just add that I sort of do my elevator pitch in the talk that I'm going, so I'm sort of preempting that. But it's about the repeated measures, the tracking change over time, over long periods of the life course. And with the COVID pandemic, as you say, that change, and knowing that the pandemic, what changes that has caused, can only be done with longitudinal studies.
Great, we're nearly there, Rebecca. For now, we're going to say goodbye, and thank you to Sabina. Thank you so much for your interventions. And thank you to all the panelists, but we're going to now move on to Dr. Alan Sánchez. Alan is a senior researcher at Grade in Lima, Peru, and he's been principal investigator of Young Lives, Peru since 2012. And he's an academic visitor at the Oxford Department of International Development. He has a DPhil in economics and an MSc in economics for development from the University of Oxford. His research is focused on analyzing the determinants and impacts of human capital from early life throughout childhood, adolescence, and early adulthood in the context of developing countries. Alan's talk is the challenges and opportunities involved in administering a phone survey to young people during a national lockdown, the case of Peru. So we're very much going to be carrying on the conversation that we just started. Over to you, Alan.
It's really a pleasure to be here and be part of this discussion. So I'm going to talk to you about my experience from the perspective of the Young Lives study in Peru. And Joe has introduced this study, but I'm going to talk to you about the experience specifically that we had last year with the phone survey. And the issue is that last year, we had a plan to actually go for a new visit to our cohort. And obviously by the beginning of the year, we had to change our plans. This is just for you to visualize. This is a sample. These are basically 20 clusters spread over across all the country. Because of migration, we now need to visit more than 300 districts over the country. There is a lot of migration, a lot of internal migration. So the one thing is that because we were going to do a new visit, we did a tracking exercise the year before, 2019. So we had up-to-date contact information. So that was like including phone numbers. So that was like really important for what happened next. So in the case of Peru, the first COVID case happened in March, and by mid-March, the government decided to start a national lockdown that was initially meant to last for only 15 days, but it became extended multiple times, all the way up to 107 days. And it was a very tough lockdown. Like you were only able to go out to buy food and medicines, and obviously to work for those that work in essential sector. But most people in practice had to stay at home. So when this happened, our first instinct was to actually contact the families, and we started designing the phone survey around that idea. So this is just a visualization that someone else did. These are the number of excess deaths over time in Peru. And this is when the national lockdown took place. Like you see, right when it started, that's when the national lockdown took place. It was a very long, slightly more than 3 months. And we did what we call the call one, kind of in the middle of the lockdown. Some calls were made after the national lockdown, but most took place during the national lockdown, so it was very difficult. There were other calls, but I'm going to focus mainly on call one because I think it was the most difficult part of the most challenging part. So there were many challenges involved in doing the phone survey during in the middle of the national lockdown. Many people were anxious. I mean, we were anxious. There were problems with access to food because it was such a long national lockdown. And people that rely on informal activities were not able to work. There were problems, obviously, with COVID in the families, and we also face issues, as also this year, about lack of oxygen, hospitals crowded. There were also methodological challenges. How do you ask about informed consent over the phone? How do you avoid fatigue? How to manage expectations? I mean, these are things that are also an issue when you visit them, but this is an entire new issue when you make a phone call. How also to keep our staff safe while we do all this. So I'm just enumerating here some strategies. Let me call them that way. I'm not sure if that's the right way to call them. But so first of all the work we did was remote. All the numerators were working from home with equipment provided by us. We had weekly meetings with the numerators to offer feedback, but also support, because it was actually tough to do the phone calls, especially at the very beginning. The phone survey was announced in our website to raise credibility, because we were concerned that maybe they were not going to believe it was us because we never actually called them. And we split the phone survey into 3 parts, in part to reduce fatigue, also for other reasons, but also to avoid fatigue, not to make it a very long phone call. call one, the first call that we did was designed to, we say in Spanish, to break the ice, to like really make a contact with them, listen to them. The call one was designed mainly to listen to them, even though we didn't record them, just to give the chance to talk. Obviously, we did some specific questions, but there were also open questions. And also, it was designed to ask for consent. We asked for consent in that call. Also, we created a question and answer document that the enumerator had at hand. So if the family had a question, we had this list of potential answers, especially about how to access public services during the lockdown. This is public information, but not everyone have it. So we did that, and eventually this document turned into a consultation guide that we sent to all participants after a couple of months. Also, I have to say that for the first time in 20 years, we offered a reciprocity payment to all participants. That actually, we thought it was important to recognize their time and some way to thank them. We have given in the past not money, but small gifts, like small presents, like a school bag or a clock. But this time, because we were not able also to visit them, we thought instead of that, let's give them some money. It was actually quite challenging, the logistics around sending that money throughout the country. But we eventually did, but it took a lot of time in some cases, because sometimes you were not able to go outside your home, so you were not able to go to the bank. So that's why it was difficult. This is just an example of the design that we use for the call. Like if you were able to if you agree to participate, it was easy. But if you were not able to participate, we had a design. Why are you not able? Because maybe you don't have time, you have doubts, you are in the middle of an emergency. So we designed a protocol for all potential scenarios with the experience of our enumerators and our field manager. And just to conclude, even though it was challenging, there are also some benefits. First of all, they were happy to hear from us. They actually were happy to have someone to talk to in such a difficult time. They also wanted their voices to be heard, and they realized that it was a way to do it. Maybe not the perfect way to do it, but one way to do it. I think also we generated good information for the country, and also we also actually provided good information to the young life families. This is public information, but actually I think it was useful for them. In hindsight, I think it would have been much more difficult not to do the phone survey and to try to contact the families after the crisis for methodological reasons, but also for the relationship. I think they were actually happy to hear from us. And so I think it was overall a good decision to do it. So I'll stop there, but I'm happy to answer your questions after. Thank you.
Thank you, Alan, so much. Please, everyone, put some questions into the question box so we can pick them up after Caroline's presentation. And we'll continue on the theme of COVID and adapting to COVID. That was so interesting, Alan. Thank you. So our next speaker is Dr. Caroline Moreau. Caroline is an associate professor in the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. And she also holds a position as senior researcher at INSERM in France. At Hopkins, she is the research director of the Global Early Adolescent Study, a multinational study exploring gender socialization and its contribution to the health of very young adolescents. She also serves as senior technical advisor for the Performance Monitoring for Action, PMA project, tracking national trends in sexual reproductive health indicators in 11 low and middle income countries and regions. The title of Caroline's talk is Opportunities and Challenges of Conducting Longitudinal Research During the COVID-19 Pandemic, Lessons from the Field. Over to you, Caroline.
Thank you, Gina, and thank you all. I really appreciate this opportunity to share some perspectives of actually to longitudinal research platforms that are much more recent than the Young Lives study. But so the Global Early Adolescence Study, and I'll refer to it as GS, is a study that explores gender socialization and its influence on adolescent health. And we enroll young people when they're 10 to 14. And this study takes place in 11 urban poor communities across 5 continents. PMA is a project that includes 8 national and subnational cohorts of women of reproductive age, and that extends from 15 to 49 years of age. And the focus is really to study family planning dynamics and more generally some sexual and reproductive health processes. So both of these projects started before COVID and were, in many cases, the cohorts were initiated prior to COVID and collected data just before the pandemic started in 2019. And so both of the platforms continued data collection throughout the pandemic in 2020 and 2021. And you see in blue kind of the follow-up surveys that occurred, 6 survey rounds for GS and 7 for PMA. But in addition, the projects repurposed the platforms to collect time-sensitive data on knowledge and attitudes and preventive practices that were specifically related to COVID. We also examined some of the implications, economic implications of the pandemic. GS specifically assessed relational, educational, and mental health implications of COVID for young people, while PMA more broadly focused on fertility desires and contraceptive behaviors during COVID. An additional aspect of GS is we plan for 3 rounds of data collection related to COVID over the course of a year. And we also had a series of focus group discussions with young people themselves initiated in these different sites. So with that, I'd like to share some of the perspectives on both the opportunities and challenges in implementing those projects in the different sites. And you'll see recurrent themes that I will approach. And first of all, kind of highlight the longstanding global partnerships of those projects that were really instrumental in carrying these global studies. I'd also like to highlight the fact that we operated in both cases from central coordinating centers. I think that proved a powerful mechanism for mobilizing, coordinating, and also facilitating country partner initiatives to adapt and expand their own platforms. So GS and PMA launched COVID surveys in 5 and 7 countries, respectively, in the course of about less than 6 months. And those results, if you're interested, are summarized in briefs or dashboards that are available on websites for GS and PMA. But these efforts were made possible by leveraging human resources, and I would start with the trained interviewers that were mobilized to carry out this work, as well as field coordinators, and of course our network of research partners. And in the case of PMA, there was also a deliberate effort to engage with governments and civil society groups to make sure that we responded to the questions that were policy and programmatically relevant to the local context. We also leveraged technical resources, repurposing ODK platforms to accommodate for new modes of data collection, online surveys in the case of GS, and that was implemented in Indonesia, Belgium, or Shanghai, or via phones in the case of PMA. A third element of success is, of course, the ability to use existing sampling frames with available contact information to identify study participants. And that was mostly done through phone contact in PMA. But we also developed innovative strategies in the case of the GS. One example is Indonesia, which used teachers to send WhatsApp messages to their students to send personalized link to questionnaires, for instance. Innovations also included virtual training in the case of PMA through YouTube videos and WhatsApp group chats and phone support to train interviewers to new COVID content and phone interviewing techniques. An important key to success is flexibility. And in the case of GS, that meant conducted standalone COVID surveys or embedding the COVID module with follow-up surveys. Obviously, a huge contribution of this work and all of these cohorts is linking pre-COVID to COVID data to assess the effects of COVID on young people's and women's health, and also identify the disparities. I think we've talked about that. So just a few words about the insights from the field. And in the case of GS, recruitment was actually quite uneven across the different settings, with more than 80% follow-up in the 2 Asian sites, but falling to about 50% in Belgium and Malawi, and down to 25% in NOLA. And I think one of the important differences was the ability to mobilize teachers. Obviously, it's easier when schools are reopened, but it was also successful in Indonesia through teachers contacting their students remotely via WhatsApp. Mass texting and direct emailing without teacher involvement proved less successful in New Orleans or Belgium, for instance. So transition to remote data collection.
Caroline, I think you're muted.
Sorry, can you hear me now?
Yes, I can. Yeah.
I think my internet is unstable, so please let me know.
So far, so good. Just those 2 seconds.
So the site partners also emphasize the need to train the staff to identify and respond to technical issues in real time. And so in the case of PMA, there was also emphasis on innovations in training young people. And I'll just quote one of our PIs in the DRC, which mentioned that people are naturally scared of what they don't know. And so sometimes they'll be hostile about innovation, and not everyone is ready to adopt innovative approaches. You need to help them to understand the advantages and the risk. And once they've seen it, they can be big fans, but you need to dare to try it. So some of the insights from our partners. So I just want to now turn to challenges, and there were notable challenges. Obviously, delays in field work in many sites, and especially in the case where the cohort studies hadn't started yet, or we only had one round of data collection. Cost increased due to innovations, but also to the implementation of preventive measures when face-to-face interviewers resumed. We also faced technical challenges, including connectivity issues, leading to multiple calls to finish interviews. And obviously, an important challenge was the selection bias, especially when survey participants' participation was predicated on phone ownership or internet connectivity. So, for instance, PMA follow-up rates range from 53% in Burkina Faso to 70% in Kenya. And so lastly, I want to raise one consideration for ethical issues related to privacy and confidentiality, especially when surveys were conducted remotely, but also in the case to face-to-face resumption due to social distancing. And that led to the inability to ensure privacy, and therefore the exclusion of certain sensitive questions, for instance, related to adverse events for GS, or GBV questions that were only asked in the case of face-to-face interviews in the GS. And lastly, it's not only about confidentiality, but it's also about the ability to respond to potential disclosures and distress, meaning important emphasis on training of providers and also mechanisms for young people to indicate if they wished to be called by research for follow-up conversations. So thank you very much. I'll just post a few references if you're interested. This research is currently being published, and happy to respond to any questions.
Great, thank you so much, Caroline. And just to say, we will be providing any links that the presenters give us, and possibly even the slides. So we'll be emailing you with further follow-up information so you can look up the various projects in your own time. And we do now have, thank you very much, Caroline. I want to turn now to our final speaker. So Professor Rebecca Hardy. Rebecca is Professor of Epidemiology and Medical Statistics at UCL and Director of CLOSER. CLOSER is known as the home of longitudinal research. It brings together world-leading longitudinal studies to maximize their use, value, and impact, and improve understanding of key biomedical and social challenges. We learned a little bit about CLOSER yesterday as well. Prior to taking up the position at CLOSER in 2019, Rebecca was program leader at the MRC Unit for Lifelong Health and Aging at UCL, which runs the MRC National Survey of Health and Development, NSHD. And the title of Rebecca's talk is Longitudinal Population Studies, Opportunities and Challenges. Very much looking forward to hearing from you, Rebecca.
Thank you, Gina. Thank you for that introduction, and hello everyone. I'm delighted to be talking at this event and for CLOSER to be one of the organisers of it. So Gina has really introduced CLOSER. So our aim is to maximise the use, value and impact of the UK's longitudinal studies to address key social and biomedical challenges. I'm just trying to move. My slides don't seem, they were moving earlier on. They don't seem to be moving now. Might just try again. No. Oh, there we go. Sorry about that. So CLOSER has 19 partner studies and includes both nationally representative studies and regional studies. And CLOSER provides resources and infrastructure for these studies, working across 5 themes: data discovery, harmonisation and linkage, training capacity building, and creating and generating impact. Now, as Gina mentioned, before becoming CLOSER Director, I worked on the MRC National Survey of Health and Development, which is a British birth cohort study of people born in 1946 and followed up ever since. So a really long-running study. So I was asked to reflect a bit on the future of longitudinal research in this talk, and I do that from a UK perspective, but hope that some of the learning will translate to lower middle income countries. And I do that having worked in, as I say, longitudinal studies for over 25 years. So over recent years, even prior to COVID, the data landscape has become ever more crowded. We've had this sort of big data revolution. Administrative data linkages, huge biobanks and information through online monitoring and social media, for example. So in this space where researchers have increasing, well, and policymakers have increasing amounts of data that they can use, how do these relatively small longitudinal studies sort of compete and demonstrate their value and ensure they can keep going? And at CLOSER's international conference just prior to the pandemic, at the start of 2020, in what turned out to be the last big international meeting that I attended, and I expect most of the delegates attended in person, there was a general consensus that longitudinal studies needed to work together to make their voice heard, to promote the key unique benefits of longitudinal studies for important research and policy questions. And I draw quite a bit on the learning from that conference in this talk. So this was my sort of key elevator pitch, if you like. So to my mind, the benefit of a longitudinal study is that it can allow us to study within-person change, sometimes across the whole of the life course. And so in my area of research, which is life course epidemiology, this diagram sort of represents where I think we can uniquely use longitudinal data. So we have a life course trajectory of a measure of health. Here it's resting heart rate, but it could be anything. And you have early life determinants of that trajectory, and then the health consequences of the different trajectories. And understanding this whole life course pathway has the potential to identify those at risk earlier in the life course. And from a more social perspective, cohort studies give a voice to different generations and different groups within society, and they can be used to study the effects of different social contexts in which people live their lives. So with the onset of the COVID-19 pandemic, where longitudinal studies were able to pivot, I think, remarkably quickly and respond to collect data at different stages of the pandemic, has only reinforced these sort of valuable aspects of longitudinal studies. So pre-pandemic, I would often talk about being able to study the impact of an event on a life course trajectory. So here, example was menopause, but of course we can add COVID-19 to this. And we have measures in these studies pre, during, and we'll have them post-pandemic, hopefully, of all aspects of participants' lives. And it's only these studies which can truly measure the impact that the pandemic has brought about. And then also the value of comparing across studies. We'll be able to study the differences by age, by region, and indeed across countries, which is so important when considering the impact of context and of policy. So here's an example from my work of the changing social inequalities in body mass index in different UK generations of children with the emergence of the obesity epidemic, so the emergence of an obesogenic environment. So I'm going to finish with a few reflections on some of the methodological and practical challenges for longitudinal studies, many of which have already been mentioned. So first, just to say that the pandemic has obviously necessitated changes in data collection, and certainly in the UK has accelerated that trend, which was already happening towards remote data collection and data linkage, particularly with administrative data and health records for obvious reasons in terms of the pandemic. And these have demonstrated that some of these challenges can be overcome when necessary. But longitudinal studies obviously run over many years, and say the one that I worked on has now run for 75 years. And getting those repeated measures is vital. And for long-running studies, it's ensuring the harmonisation within studies is really key. And data harmonisation is more often talked about between studies, which of course is important. But even different modes of data collection, we need to ensure that our repeated measures are comparable. And I think having worked on a longitudinal study, there's this real balancing act when you're designing data collections in that you want to react and to policy and research questions of the time to introduce new measures, but you've also got to balance that against the continuity with what you've had before. The timing of data collections, we'd all like to be able to plan these in advance with nice equally spaced gaps in our between our data collections. But often we end up with wide gaps, and this is because data collection depends on funding, and all studies have this challenge where data collections are often funded on a collection by collection basis. I think, as has come out in the talks already, we do have to remember the value of the study participants and ensuring maintenance of the samples. And for the study that I worked on, these participants have given the whole of their lives to contribute to the study. And at our 2020 conference, which there was the international perspective was really interesting here, and I think that's come out today, in that local knowledge is paramount in developing engagement strategies to target your particular population and particular age groups. But as well as valuing the participants, we need to value the staff who work on these studies to keep these studies running. And it's vital that we train the next generation and encourage the next generation of people who are going to carry on and work on those studies. So training capacity to build the next generation, not just of the people that are going to analyse the data, but the people that are going to collect the data and run these studies and look after these studies is vital. So COVID has only further demonstrated really the unique value and the importance of longitudinal studies and the power of the studies in working together. And a message that continually comes through at closer events is the desire to work together, to share information and best practice, and to be able to share what works and perhaps even more importantly, what doesn't work and when things go wrong. And by working together, increasing the discovery and the use of these studies, pooling findings from across diverse studies, I think we can really maximise the research and policy impact into the future. Thank you for listening.
Great, thank you so much, Rebecca, for that kind of reflective but also forward-looking presentation. Lots of questions are coming up. I mean, you mentioned the importance of documenting and sharing, and that does kind of link to a question from Kath Porter, stemming from your talk, which she says, Rebecca's mentioned the accelerated trend towards data linkage during the pandemic. What are the panel's reflections on whether informed consent for data linkage can be gained over the phone? So again, linking with the ethics question as well.
It's a very specific question. I mean, you know, there's huge challenges in terms of data linkage, and I think that obviously varies from country to country and the legislation that's in place. There's been huge barriers to getting linkage to hospital and administrative records in the UK, but the pandemic has kind of push that to the top of the list so that there is movement and working together to make sure that, you know, those linkages are starting to happen. And getting the informed consent, again, it depends on the country and the context that you're working in.
Thank you. I'm going to follow up with a question also directed towards you, Rebecca, from Marta, and she asks, are there any survey questions, topics, methodology from longitudinal studies in low and middle income countries? Thanks, Rebecca. Any survey questions, topic, methodology, longitudinal studies in low and middle income countries could borrow from UK cohort experience? So what learning from the UK might you offer to many of the people who are tuned into this particular session?
I mean, I think, you know, a lot of it is knowing your sample and your population. I mean, I've worked on a birth cohort of people born in 1946, and the way that you engage with people of that age is very different to, for example, how the Millennium Cohort study might engage with their participants. So, you know, I think it's difficult. I think one of the learnings is that it's difficult to generalize, and you need that local knowledge, and you need to understand your participants. What can you learn? I mean, I think for me, one of the things, and, you know, you may already be redoing this, but a key thing that I want to see sort of developed across the longitudinal community is this. I'm very passionate about having these repeated measures and sharing measures so that we can compare within countries, across cohorts and across regions, but also that then we can move to looking at country comparisons. So sharing information, sharing those methodological studies that studies do, but they often don't get published. And it's great to see that Young Lives is actually putting, you know, your learning out there, because sometimes this doesn't get put out there. So sharing and documenting all those experiences, which we haven't always done in the past, I think is really helpful.
Great, thank you. I mean, in the academic world, it's not necessarily valued like the empirical research and papers are valued.
That's right.
And that we push forward on this. I am going to ask a question that could be answered through the lens of pre-COVID, because it's important that we also think in the longer term. The question is from Elizabeth, and she says she's interested to know more about the strategies to take care of the staff that collect the data. So that could apply both in the context of COVID, but of course, the people that we work with experience challenges outside of the context of a pandemic crisis. So to know more about the strategies to take care of the staff and the researchers who collect the data. Would anyone like to answer that?
Maybe I can start, and I think that the question was made by Elizabeth. Thanks, Elizabeth. So, I mean, in the context of the phone survey during the lockdown, the key thing for us first was to make sure that the enumerators didn't have to go out, or our staff in general didn't have to go out of home for work reasons. So I think we managed to do that very well. Like we sent all the equipment to them, the cell phones, the tablets, the laptops for our research assistants, etc. So then the well-being, the mental health of them was also key. Like especially for the enumerators, it was very stressful to do these phone calls for many different reasons. Like, if the family has a problem, you have to deal with a problem, and you provide information, but sometimes that's not enough. We had weekly phone calls with weekly meetings to talk about the cases I found. As in the past, when we found a true emergency, we had to act. We had to find a way to act directly. And that's the way you have to do it. Also, we have to be very flexible, especially with enumerators. Just to give an example, during the lockdown, there was a curfew during the weekends, so you were not able to go out even to buy food during the weekend. So we used to have our meetings with the enumerators on Fridays, but they asked us to give them the Friday free to be able to go and do groceries. So that meant we had to move our weekly meeting call to Saturday. Probably we didn't want to be working on Saturday, but that was the only way for them to deal with things at home. And I think that's also one of the things that I don't think we were able to solve, to be honest, is that they were working from home. And also, as we all know, it's difficult to do that if you have children, to find a space to make your work. So and we try to be as flexible as possible, but I don't think we didn't find a perfect answer for that challenge. That remains a challenge, I think.
Would anyone else like to add to that from another project?
This is Caroline. I guess I can give kind of, some perspective based on PMA. One of the challenges was this was generally a face-to-face interview, and the interviewers are women from the local communities who are trained to do this data collection. And so there was a real challenge in thinking about how to move this platform into phone surveys. And so one of their innovations was really to do a virtual training. And obviously a lot of women had connectivity issues. And so the virtual training had to have a number of adaptations asynchronous so that they could follow, but also have engagement. And so that's how we engage with WhatsApp groups between the supervisors and the group of women so that they could follow the training. It was a 3-day training, and they could follow at their own pace and yet also have group types of facilities to make sure that they were on board. And I think, that speaks also to their family responsibilities and the ways that, their professional responsibilities had to blend also with their family responsibilities. So giving more flexibility during training was definitely one of the ways that we address the issues.
One of the questions, or one of the terms that kept coming up both in your presentation and throughout, is the idea of sort of innovations. Rebecca also talked about the importance of continuity, yet being flexible, as did Ginny with the discussion around ethics. I am curious about what kinds of innovations, whether it's training or incentives or otherwise, and practices that were introduced during the context of COVID that you think might actually be worth retaining in the recovery period and beyond once face-to-face research is possible. Does anyone have any thoughts on that?
Well, that's Caroline again, but I guess I'm not quite sure. In the case of the Global Early Adolescence Study, this was the very first time we tried online data collection, and obviously didn't work across all the sites. We didn't even try in some sites, such as the DRC in Malawi, just because phone equipment was so rare that it didn't make a lot of sense to do that. But it was a huge success in Indonesia, and actually the data quality was high, which was one of the questions that we were concerned about. But the reason it was a success is because we used teachers as a way to engage young people, and the teachers sent students WhatsApp messages for them to connect to personalized surveys. So moving forward, these are young people, but moving forward and thinking about the cohort over the years, obviously we won't have this teacher support. So we need to think about other strategies to maintain that connection between young people and virtual platforms, because I do think that human interface is very important and remains important.
I do think there will be this, there was this push, certainly in the UK, toward this more remote data collection, and by necessity that has been done. And I think what studies are finding, though, is that some people are actually engaging more with the online. So you're going to have this sort of mixed modes data collection, which will maximize response, that some people prefer online, some people will prefer in person, some people will prefer telephone. And I think that's where this understanding the differences in response across those different modes is going to be really important. So that's sort of part of the thing I was talking about, sort of harmonizing. You might be asking the same questions, but actually in different modes, they might mean something different.
Right, interesting. I'll offer this question, which is now top of our list, from Kath. Given the limitations and ethics posed by phone surveys in terms of types and amount of questions asked or data collected, what are the opportunities and challenges to doing more semi-structured questions, more akin to qualitative interviews? And Ginny and Joe might also have views on, we've been thinking about doing qualitative interviews remotely within Young Lives, but they might also have some reflections on that, but I'll open it up also widely.
I was going to actually respond a little bit to the earlier point. Maybe I can bring those two together a bit. Sure. But in terms of longitudinal research and the costs and the importance of the repeating of measures, but the need also to be able to respond and innovate and so on, I think this idea that we'll be doing more remote work in the future, more online work it's pretty much inevitable. And I do think COVID has accelerated. But the other thing that in Young Lives I thought was really helpful was having a much more hybrid model. So you had the longitudinal, the surveys and the longitudinal qualitative research element, but also a lot of bolt-on cross-sectional studies, which I think are actually a way of doing qualitative work that chases down on very specific topics, that deals with issues that arise, findings that emerge that you weren't aware of beforehand, that you can then address, but within a context of a wider longitudinal study. And that kind of an innovation, I think, is both cost effective, but also very powerful for policy impact, because, the work that we did on, female genital cutting, for example, which was an issue that emerged only in Ethiopia. It emerged as the young people reached their teens, and it turned out to be really important to them. You couldn't have included that in a survey, longitudinal survey. You couldn't really have included it without these kind of drilling down sort of work that you can do. And I think that'll be a sort of more hybrid approach in the future, as well as what Rebecca was saying, more linking, more data linking. And, I think pooling, harmonizing data across studies is absolutely got to come. I'm surprised, however, how difficult it is. I'm surprised how few efforts there still are, particularly on data harmonization across subject studies. Gina, you're muted.
Yeah. Anybody else want to input?
If I may also try to reflect about the two questions, actually. So, for instance, one very concrete aspect is that for, the Young Lives study tracks two cohorts, and one is the older cohort. And over time, it becomes more difficult and more expensive to track them. So you might think about a scenario in which we, at some point in time, we rely mainly on phone service for the older cohort. So that's one thing. Another aspect is that we've been thinking about contacting the kids, the participants that migrated outside the country, and obviously the phone service can be done especially for them. And another reflection about this is that I think this is a door that once you open, it's hard to close. And just to give an example, so each enumerator had a phone that was provided by Grade. So once we concluded the phone survey, we thought, are we supposed to close these phone numbers? What if they call us? If they, for some reason, they would just want to contact us. So all the phones remain operating now, even though we finished the phone survey in December, and we've been receiving some messages, not too many, some messages over time, sometimes just to say hi to a numerator. But this is a door that you cannot close once you open. So the phones remain open. We plan to keep them on, even though, and we try as much as possible that the same enumerator keeps the same phone line, although obviously that's not always possible because obviously enumerator might find other things to do. But so I think in practice, even though I agree entirely with the fact that you cannot replace a visit with a phone call, but even to contact the family for the visit, we're going to rely much more now on the phones. We typically didn't do. We're probably going to go and say, hey, we're about to go to your community in one week, just to let you know we're going to be around. Just to give an example, we're going to be using a lot of phones from now on.
Okay, great. Thank you so much. I mean, we are now at 3:30, so I will close the session. But thank you all for coming. It's all been very, very interesting and inspiring in this difficult time of change, but we can clearly see a role for longitudinal research going forward. Thank you. Thank you, everyone.